Omar is the founder of Find Gumption. He's a medical doctor with 10 years of data analytics, named HIMSS Future 50 and published author at HL7 and AHIMA conferences. Omar is the founder of Human Dash, a startup that brings next generation mental health techniques into the hands of busy top performers in Silicon Valley. Omar, welcome, and the stage is yours.
Thank you so much, Uli. Thank you for having me here. Hi, everyone. My name is Omar. I am the founder of Gumption Health. You heard multiple names, and that's because I'm actually officially launching our first product today with all of you here, and you'll get a chance to check out what we do firsthand. And I have a lot of goodies for everyone with us in the conversation today. And my presentation is really about a question that I've been thinking about for a very long time, which is why don't we do the things that we know are good for our health? And I want you to send me the answers, tell me what you think in the chat, but this is something that I've been thinking about for a very long time. Why don't we do the things that we know are good for our health? And I started thinking about this as a medical doctor when I saw my patients coming back to me over and over and over again with the same problems until I myself became a patient and went through a bout of depression and burnout, which I could only work through at that point with very little resources. And I switched careers thinking that that is the answer. And as any consultant knows, being part of the job description is eating out all day and drinking out all night. And that was all fun until 5 years later when I realized I was on the verge of prediabetes, learning about that from a hemoglobin A1C test that was random. And I was 0.1% away of prediabetes, which then got me into lifestyle medicine. So I got certified by the Institute of Functional Medicine to start delivering these lifestyle interventions to help clients at that point. But while I was doing the program, I also had a lot of backaches and sleep disorders. So I've been thinking about this throughout my career and trying to help people lessen their suffering or try to figure out health for my own self. And what I found to be able, I still work through managing all of these conditions, but luckily I've done a lot of progress and I live at least symptom-free right now because of an understanding that if there's one thing I want you to take away is that we've spent a lot of time understanding our physical health. We have excellent science and medicine that helps us understand what we need to do. And COVID hit and we started understanding that we have this whole mental health aspect, which is our cognitive ability to understand how to do the things that we know that we want to do. And I firmly believe that the future is all going to be about our emotional health, which asks why do we want or why do we not want to do the things that we know we should do. And before I give you a snapshot about where we're going into the future, I just want to bring you back into the past really quickly with a legend of Parsifal, which was written in 1901. And it's a beautiful story that I think is very relevant to modern psychology and where lifestyle medicine is going. And it's a story about a wounded king that heard of a prophecy of a brave soldier that's going to come to the king's court and heal the king, at which point the Holy Grail is going to light up. And sure enough, there was Parsifal. That was an orphan warrior that fought a lot of knights and thought that the prophecy could be fulfilled by him. So he kept going back so he went to the king's court and presented him with all the armor and weapons that he won from all the battles, showing his credentials. And the king just felt even in more agony and then sent him away from the court. And Parsifal, being frustrated, kept doing the same things. And he kept going back to the king's court, asking him or showing him kind of more of these fights. And over and over again, the king would moan and send him out until one day, Parsifal got really angry and frustrated and decided to do something about it. So he went back into the court and started screaming at the king in frustration. What do I need to do for you to approve of me? And what do I need to do to get the Holy Grail? I've done everything a knight could do for a king. And the king kept moaning and asked them to send him out from the court yet again, at which point Parsifal lurched into the throne, holding the king out of anger. But then suddenly the king he was able to see the wound in the king, and that's when he asked him the critical question, which is, why are you suffering? And that is a critical question when we think of the holy grail of health. And it's something that modern psychology has been screaming at us through the work of Carl Jung and then many others that is encapsulated really by this quote of, until you make the unconscious conscious, it will direct your life and you will call it fate. In the context of our health, I think our emotions are really the driving forces behind our outcomes ultimately. And what Carl Jung was trying to tell us, and what neuroscience and modern psychology and methods such as internal family systems and somatic therapy is showing us, is that there are these different parts of us that are that want different things. And the future is going to be answering that question by understanding ourselves and really understanding the different parts of us. What does the wounded king inside of us need in order to actually be healed? And what does the inner child want, and what does the angry adolescent want? Really understanding these different warring factions is what Carl Jung and modern psychology is telling us, is that we all have this frustration of Parsifal inside of us that gets in the way of doing the things that we know we need to do. And so I think the future is going to be not of separate organs or separate body, mind, heart structures, but a unified and interdependent relationship between not just the different parts of our mind, but throughout all these systems. So really linking how we feel and our cognitive abilities and our actual physical sensations and biomarkers and all of that through our nervous system and how it's all related. And that's what we think about at Gumption Health all the time. How do we move people from a state of high cortisol, anxiety, drowning, through little habits that they are ready for, and I'll talk about that in a second, to a state of higher gumption that is not just rooted in dopamine and endorphins and achievement, like Parsifal kept doing, but ultimately leading to oxytocin and serotonin-driven states, which I call the state of gumption. And the way we do that is through a program that offers neuropsychology coaching based on evidence-based modalities such as somatic therapy and IFS, and that's both on Zoom or in the clinic in the marina. And then we have, clients are ready to do lifestyle changes where they go through content and accountability structures that allow them to really start making the habits that they are ready for, not what people are telling them that they need to do, which is a huge difference, as I will show you in a second. But ultimately, we measure both subjective and objective measures to make sure that people are getting the outcomes that they need and that aligns with their vision. And we're getting a lot of great results. And the reason is not because of some hack or some routine or some protocol. The reason why we've been successful is because we're helping clients ask themselves two really important questions. And the first one is, how ready are you for change? And that is something that we frequently miss when we're starting a new routine or new habits. But that's based on Prochaska's research into readiness for change, which we can actually measure. And there are 6 different phases for each lifestyle habit. And then the other question, which is equally important, is how much emotional resilience do you have to pursue these goals or these health goals, which is the science of self-compassion. Again, really well-studied score by Kristen Neff, and you can go to selfcompassion.org to see more of her work. And ultimately, what we've designed based on a lot of the work that I've seen over the past 3 years are 4 different gumption states. And so the high state is a state of balanced, as a state of being balanced, where high self-compassion and high habit change or readiness are available so that we can push ourselves, we can pursue bigger goals in work or life because we know we're balanced. However, medium gumption is more of an overachiever state, which is not to say that it's bad, but we have a lot of readiness. However, if we're low on self-compassion, shame can stop us from having longevity in these habits. There's then the explorer, which is the opposite of the overachiever. That's when we have really high self-compassion, but low habit readiness. This requires small actions and understanding what we want, or doing a lab test to understand what we need to do. And then ultimately, there is the state of being stuck. And I chose a whale to remind us that no matter how big we are, no matter how successful we are, we go through the stuck phase, and it's actually a really good indicator of our resilience, especially our shame resilience. And what I want you to remember is that this is a momentary state. This is not a diagnostic test. This is a way to show you how you're feeling based on these evidence-based metrics at any given moment. It could be how you're feeling right now or how you're feeling next week. The important thing is that it always changes. And that's what I want to launch with you today. So I actually put together our first product that you can all use by going to report.findgumption.com, and it'll show you which state you're in, detailed self-compassion scores, and your habit readiness to help you identify the next actions. And you can always also schedule a 30-minute consultation if you want to really get deeper. And I'd be happy to talk to anyone at InnovatorMD and also offer special discounts for the program. Thank you again for having me, Uli and Rushi, and I'm excited and thrilled to hear your questions.
Great. Thank you, Omar. Thank you. This is what now I realize what you've been working on. I know that you've called it Gumption, but this is the practical application of what you've been thinking and doing. Omar is a great thinker, and of course, he's a great doer too. I'm sure he has big plans on how to productize and hopefully bring this to market. So I have one question. Is this more like a business to business or business to consumer model, where how are you going to make money out of this thing?
I'm currently making money by a B2C model. It's a 6-week program that has specific outcomes, and then it's a membership model where it's more group coaching. But I believe the one-on-one component is really critical to help someone map out their inner world. And of course, thinking of enterprise, thinking of taking this to professionals through employers is always on my mind ever since I was an employee myself. However, I don't think it's the right time for the market to ask employers to invest in that. That's just not where the dynamics are. So what we're doing is growing it slowly and really growing a community of people that are AI engineers, people that are lawyers, doctors, mostly in the Bay Area, and really growing that through referrals and bringing in people to kind of create this mastermind also. Because again, it's not about one solution for everything. It's about people figuring this stuff out together.
Great. Thank you. Let's see. Margaret has a question. Margaret, go ahead and ask.
Yes. Hi, Omar. Thanks for the nice presentation. I have a question about emotional well-being. It's a very complex subject, first of all.
Yes.
And many factors can be contributing to that. I'm just curious in terms of your clinical evidence and how effective the method works. And maybe you can elaborate a little bit about that.
Yeah, absolutely. Thank you for that very thoughtful question. First of all, I agree with you that it's complex, and that's why having a stake in the ground like Kristen Neff's body of research. So she's the world's top researcher of self-compassion. And this self-compassion scale was really exciting to find because it helped me find like the first step to quantifying, or my data brain wanting to quantify something like emotional health. And it's a measure of it has 6 subscales actually. So you're able to see your separate scores on self-kindness versus self-compassion versus self-judgment, common humanity versus isolation, and mindfulness versus over-identification. And it breaks down each subscale has an indication. So overachievement, they found to have strong correlation with depression, for instance. Sorry, not overachievement, over-identification with one side of us versus the other. So each subscale has that, and there's also many ways to measure compassion. Some are very specific on certain patient populations. However, what we're using here is the self-compassion score because that's the best and most studied test for emotional health that I found. It's not a clinical diagnostic also to answer you. It's more of a in the moment, where is your emotional state? So it just helps you know whether to push yourself harder or to give yourself some rest rather than diagnosing or treating even.
Great, thank you.
Rafael has a question. Rafael, go ahead.
Hi, Omar. Really interesting work that you're doing. So in some of the digital work that we've done with clients, we see many startups with digital tools struggle with ongoing adoption and utilization of their digital tools. Like, what are the strategies that you're using to get people to come back, right? So sometimes you hear about using like gamification strategies or opportunities to have a user engage by entering data, with getting some of reporting back, right, as a value add. What's the strategy that you're using to get people to come back to the app?
That's beautiful. And first of all, like I didn't build an app per se. We use app to engage with like third party. What we really built, our proprietary piece of technology, is really dashboards. So I build dashboards and streamline data around not just the subjective measures, but also their biomarkers, their labs. And once they're using these third-party applications, we can also extract information from their wearables. And then the thing is, like, we're at a place where we're fascinated by data, so we're all collecting all sorts of information, but there isn't one person that is like helping you figure that out. So I think the analysis piece, beyond the one-on-one sessions in the beginning, keeps people, and even like the kind of evidence-based psychotherapy part of it, the IFS piece, which I didn't really get into the method, but basically we're documenting also these kind of like mental emotions, or like the feelings, these experiential states that they have, so that they have a map, a visual map of what is going on when they get triggered. What happens when my boss tells me this? What happens when my mom tells me that? And it's like figuring out also like the core wounds or traumas that are driving a lot of this behavior. So I think putting it all together, physical health, emotional health, mental health in one visual, is what keeps people interested, because they can also see the trends of their self-compassion score, which is really how it's meant to be used. So anyone that used the report right now, don't get bogged down if you get a low score, because it's all about the trend. And that's one of the things that are very sticky with our clients. I appreciate the question, Rafael.
Thank you.
And looking forward to hear more about your work. Also, I'd love to connect.
Yeah, let's talk.
Thank you, Rafael. Thomas has a question. Go ahead.
Hey, Omar. Tom Weiss from Oregon. My wife has been an IFS therapist for decades, and so I know just enough to be slightly dangerous about internal family systems. I'm a retired orthopedic surgeon. But my question is, so do you employ a bunch of IFS certified folks to do the initial intake, and/or is then the subscription model follow up with clinicians on a check-in? Because most therapists, I mean, there's some therapists that say 6 weeks is all I need, and I can get people on the right track. Or some would say 6 weeks is peeing in the ocean, and you need to have therapy every week forever. I mean, how do you gauge that and parse out the actual provision of internal family systems intervention and analysis?
Excellent question. Also would love to connect with you and talk more. I feel like we can spend the rest of the day, our life, discussing this. It's a really thoughtful question. I believe that when we think of mental health, we think of mental health diseases. So if someone is in the throes of depression or anxiety or any other mental health disease, they need a mental health professional, and they probably need more than 6 weeks. Most of the people that come to us are professionals that have been through depression before, and they come not with the problem of depression, they come with the problem of being afraid to face another episode of depression. So at this point, again, that's the Gumption state piece, is like the initial assessment requires that the person, the person may be on medications, maybe already seeing a therapist, but it's really them wanting to get to that next level of confidence in their health, which is kind of what we deliver ultimately. So to answer your question, the intake is not done by a therapist, but we use IFS certified therapists. We don't hire them, we partner with them, but we take them through a training program on how to document data. So how to turn like their sessions into structured data. And then using that kind of, proprietary method with the dashboard, being able to do that in the back end, while the therapist delivers a very specific 6-week program where we go, as like through the protectors. And what we found is that 6 weeks is enough time to get to the unburdening phase. So the client trusts the therapist and the parts trust each other for us to do a little bit of lifting off that burden, which then gives the person, I believe that once you see it, you can't unsee it. However, if if this is like an intervention for depression or a very clinical precision medicine kind of approach to mental health, of course, it wouldn't be that wouldn't be effective. But that's not our population. But I agree with you. Some therapists. I personally don't think therapy needs to be forever, although that's the model, and that's one also thing that is more of an interesting discussion. But it's not kind of what we're trying to achieve. We're trying to get people on their feet and feeling confident.
Yeah, and have you interfaced at all with Scott Miller's work? He's one of the early folks that really looked at the efficacy of therapy, and his response was a lot of it doesn't work because we don't document anything appropriately. And if you simply ask the client, how are you feeling today? I mean, that is almost more important than any sort of checkbox. But you may want to look. He's been very critical of his own field in that psychotherapy has not been very good at self-evaluation. And like you're saying, you need to see the therapist every week. When in fact, if you actually ask the patient if they are getting better, many of them don't have an answer, and many times that answer is no.
Thank you so much. I look forward to connecting with you and talking more about that. And also, thank you. I had no idea about his work. Thank you. I look forward to delving in.
Thank you. Great. Let's see. We have one more question. Margaret Wong. Margaret, go ahead.
Omar, listening to the other questions, I'm just going to tag along and make a suggestion, another question. I think it would be really nice if you put a slide to, show the evidence and the effectiveness and also your traction. That will speak, more. I see a couple of questions sort of in line with that. If you can answer those questions with one slide, I think it would be very helpful. And also on top of that, this field, I'm sure you probably know, it's a very crowded area. So that it's kind of challenging to really, raise yourself and up the radar. But I think wish you the very best.
Thank you so much.
Thank you. Thank you, Margaret. And thank you, Omar. Wishing you the best, and would like to hear updates as you go along. And feel free to pop in and connect with InnovatorMD folks that may be able to help you in this journey.
Absolutely.
Thank you.
Thank you for your work, Uli, and thanks for having us.
Sure.